Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenters are Dr. Carmen Agcaoili and Katie Choi. Dr. Agcaoili graduated from the University of the Philippines and the University of East Ramon Magsaysay Medical Center. She completed her internal medicine residency at St. Barnabas Hospital, an affiliate of Cornell Medical Center in New York, and she did her fellowship in pulmonary critical care at the University of Southern California. Dr. Agcaoili is board certified in internal medicine, pulmonary disease, and critical care. She is a fellow of the American College of Chest Physicians, and Dr. Agcaoili is also the medical director of the Medical Intensivist Hospitalist Services at Washington Hospital. Katie Choi is currently the Washington Hospital Nursing Director of Patient and Staff Education. She was appointed as the project director for the Washington Hospital Sepsis Program. Katie has her master's degree in nursing and is board certified in 2 nursing specialties.
Good afternoon, everybody. Some of you used to be my patients and friends. Welcome to the sepsis talk. So you'll find out later on why this talk is important. So let's pretend you are the patient. Imagine just for a moment, it says. And you've been feeling sick. So for a week now, you have abdominal cramps and pain in the flank area. You're frequently urinating, and your urine kind of bad smelling, and you're achy all over. So that's you. Today, your pain is worse. You know, the abdominal cramps and flank pain. Fever is higher. You're feeling horrible. You're dizzy, and it's after office hours. You can either call your doctor, but a loved one brings you to the emergency room. So in the emergency room, your temperature was 103.4. Is that high or low? High. Your blood pressure is 80/50. Low. Your heart rate, 45. That's low, right? You know, usually with fever, you should have a fast heart rate unless you're on metoprolol or beta blocker. And your respiratory rate is what? High or low? High. High. It's usually less than 20, right? Between 10 to 20 breaths per minute. So you're breathing a little bit faster, so it's faster. And then in the emergency room, they have to take your labs, and they found out that your white count is elevated. There's a lot of white cells in the urine, also many bacteria. And lactate is elevated. It's usually 1.7 to 2 point something, 2.1. So lactate, you probably heard about athletes running. They're the product of anaerobic metabolism, meaning to say when there's not much oxygen or decreased blood flow in the body, lactate levels increases or lactic acid increases. So that's acid, it makes the blood acidic. In sepsis, things happen like that. There's decreased perfusion. You'll know later on. So their lactate's elevated. So they have to treat you in their emergency room with IV fluids, antibiotics, and continuous monitoring. So they hook you up on the EKG machine. They look at your heart rhythm. They check your blood vessel. Remember your blood pressure and your pulse and your temperature. They continuously monitor you. And then after giving that, they transfer you to the intensive care unit. That means that you're really sick. You're sepsis, you're septic, and you're really sick. At this time, your mortality rate or your chances to die is between 20 to 45%, depending on how sick you are. So we'll learn more about sepsis. Did I catch your attention? Thank you very much. So sepsis, what are the facts? The leading causes of death in the US, you probably know this, 1 to 10, it's not sepsis, it's now number 11, it used to be number 10. Heart disease still 1, cancer, if you have chronic obstructive or lower respiratory disease, stroke, and so on and so forth, okay? But just remember this, we're number 11, but it's still that important. Very much important with sepsis is community awareness. That's why you're here. It can develop very quickly. It should be rapidly diagnosed, and prompt treatment is important. That's why you're here. You're going to be our vehicle to spread the word. And for you knowing, you can let your other friends know. It should be treated like heart attack and stroke. These are time-sensitive illness, meaning to say, once you know that you're having a heart attack or stroke, you need to call the ambulance, you need to be in the emergency room so that they can properly treat you, because within 3 to 3 hours, you need to have some treatment with heart attack. Just like sepsis, you need to be seen by a doctor, you need to tell your doctor or be seen in the emergency room. So it's important that you get to know what sepsis is. So at Washington Hospital, it's one of our top 10 diagnoses in the hospital and also in the intensive care unit. And if you're interested about the cost, it's estimated treating patients with sepsis about $17 billion per year. Another fact about sepsis is that complications, you can have 50% has complications and mostly sometimes become permanent organ injury, like kidney injury, needing dialysis, or lung injury, this is acute respiratory distress syndrome, needing tracheostomy, or you're very deconditioned, and now we are now recognizing post-ICU syndrome, which is things that happen after you go home. You have ICU acquired weakness, you're very weak, sometimes brain dysfunction, you don't remember what happened, and you're not eligible to go back to your job again. So that's very real and important. Sometimes they're having nightmares, like post-traumatic stress syndrome. They're now recognizing all of these things. And one of the things that causes ARDS is sepsis. And sepsis, more than 40% of the time, causes permanent injury in some patients. So what is sepsis? It's derived from the Greek word decay or to rotten. And it is an illness that affects all parts of your body and occurs in an overwhelming response to an infection and can be quickly become life-threatening. So sepsis begins with an infection. You should always have an infection. Either it's in the lung, bladder, wound, abdominal infection, or central nervous infection, or any kind of infection. You know an infection, right? It's an invasion of an organism in a sterile field. That's an infection. There is a bug, whether it's bacteria, virus, or fungus, or any kind of organism. It's not just bacteria. It can cause pneumonia, and this is a lobar pneumonia, or just a soft tissue infection. Inflammation, especially when you're diabetic, you don't feel it, and you'll just realize that you have cellulitis or soft tissue infection. Now, when you have an infection, sometimes you don't have signs and symptoms, or what we call SIRS. This is the Systemic Inflammatory Response Syndrome, or the signs and symptoms. I taught you about the temperature, right? Temperature changes greater than 38 or less than 36, increased respiratory rate, increased heart rate, or white blood count is very low or very high, or you're confused. Those are the signs and symptoms. We call them, quote unquote, systemic inflammatory response syndrome. In other words, in layman's term, it's signs and symptoms. So you have an infection plus SIRS, which is your signs and symptoms. That's when you kind of think, oh, this is sepsis. Because you might just have a pus, but no fever, no increased heart rate, no confusion. I think this one probably just needs an antibiotic or needs to be. But when you start having fever, increased respiratory rate, and things like that, now you need to think about sepsis. The light bulb is turned on. Okay, just to show you the spectrum, It starts with an infection and SIRS, or signs and symptoms. They merge together, and you think about sepsis. The sepsis can become severe. The lactates are up here, and there's end organ problem, like the kidneys now are getting involved, you're more confused, or you get shocked, your blood pressure dropped, and you needed some medication, or this is the other thing that we don't want to happen. Now, you can have the signs and symptoms, which is SIRS, but they're not septic. Because if you have burn or trauma or pancreatitis, inflammation, but you don't have the infection, that's not sepsis. You have the signs and symptoms, but you have to have an infection. So in burns or trauma, there's no infection there. It's just a violation of the body, so you will have fever, like anaphylactic reaction. You're allergic. You get short of breath, you sometimes have a fever, but it's not due to an infection. That's not sepsis. And this is the reason why you don't want to have this. Why you need to recognize this right away. Because you don't want it to go this way. Who is at risk? The very young and the elderly, I guess greater than 65. Men more than women. In minority populations, where probably it's crowded and more prone to infection. People with chronic diseases, like most of us, if you have COPD, emphysema, chronic asthma, kind of a problem, heart disease, congestive heart failure, history of heart attack, liver disease, especially cirrhosis and hepatitis, chronic hepatitis, weakened immune system like HIV or AIDS, or cancer, diabetic, uncontrolled, or immunosuppressive, you're on chemotherapy medications. You're at greater risk to have infection. And I guess demented patients were also people that can have high risk for sepsis. Also, invasive procedures. Like in some cases, sometimes simple surgery, but you have history of diabetes, or you have a heart murmur and things like that, you needed to take some medication before you do colonoscopy or some other procedures. So some procedures can be at risk. You can be at risk. So just to let you know, the high-profile cases, our Pope John Paul died of sepsis in 2005. Mariana Beard, he's a Brazilian model who had a bladder infection and goes uncontrolled and died of that. And he was popular in New York City. He's a 12-year-old from Queens, New York. It was nationwide movement to address issue about childhood sepsis. He had a bruise from, I think, baseball game, and he went to the emergency room and was treated, but then in the next couple of days, it got worse, and he went into septic shock and died. So those are just the high-profile cases, but we have more at home. 61% of septic cases, first encounter is in the emergency room. So you have already seen the signs and symptoms of sepsis, right? If you have 2 or more of this becomes more important. So again, cannot emphasize the importance of infection and the signs and symptoms or SIRS. Together, they're called sepsis, right? So we need always for you guys or for us to give a good, complete history to the physician, which contain when the symptoms began, all of your symptoms, the color and amount of the mucus, even the smell sometimes, for me as the lung specialist before. Chronic illness you may have, the health of others at home is important, recent trips you've made, and medications you are currently taking. Some medication can decrease your immune system too. And again, I'm repeating everything again, fever, chills and shaking, rapid breathing and rapid heart rate, confusion and disorientation, sometimes nausea and vomiting. And I already told you about the SIRS, that's not sepsis, right? The pancreatitis, the trauma, the burns are not really sepsis because there's no source of infection. But it's also a cause for alarm. You just need to look for sources of infection. And if you're not sure, always call your doctor. And many other medical conditions can present with similar symptoms when you're having a heart attack, right? You can have chest pain, and then you become short of breath, and then your heart rate can be fast also. And acute kidney disease. So how is sepsis treated? It's easy. The most important is to recognize it and to have prompt and appropriate treatment. So we do rapid screening in the emergency department on the hospital wards, and this is not just done in the emergency room, it's all done worldwide, hospital-wide. And this because of the effort of Katie Choi, educating all the nurses to be able to recognize the sign and symptom of sepsis. And then they start the early intervention. Now, we also treat by bundle, meaning to say we put all things together, not just one antibiotic here, one IV fluid. We put within an hour, a certain period of time, we give the fluids, we give the antibiotics, we check the sugar, we check everything within a period of time, with 1 to 3 hours, depending on where you are. So it's called bundled treatment. That's why if you bundle the treatment, it appears like you have better outcome. Okay, we do diagnostic tests to find out the severity of the sepsis, to find out where the infection is. Like I told you about the lactic acid, it's usually elevated because it's a sign of decreased blood flow to a part of the body. Then we do all these blood tests, sputum if you're coughing, ruling out pneumonia, or CSF, the cerebrospinal fluid, if you're ruling out a meningitis. And then also imaging just to find out what other parts of your body is inflamed. So in treatment, I told you about the bundle treatment. We look at the patient as a whole. Within an hour, we have to give an antibiotic within 1 to 3 hours time. We give you IV fluids right away. And if you're really an oxygen, these three. This depends on your condition. There are some patients on admission, once they go to the ICU, we start them on dialysis. If their kidneys shut down right away, we start them on dialysis. Or we put them on a mechanical ventilation. Or most importantly, if it's something you can take out by surgery, we call them to take it out right away. Source control is what we call it. So the IV fluids, you'll be given that kind of sort in ER or ICU, and then the antibiotics. You know, the best thing that ever happened to us is when we discovered penicillin, remember? We were able to save a lot of soldiers' life. And then I told you about the mechanical ventilation. If you need it, it could be just temporary, mostly temporary for some patients. That's why we don't want our chronic lung patients to be sick of pneumonia or sepsis, because once they're intubated, it's harder for us to pull out the tube. But these are sometimes temporary. But for some cases, it can be permanent. Or dialysis also. Again, if you're diabetic and you have chronic hypertension and you do have a kidney problem already, it's not zero, but stage something, having sepsis, that can get worse. And you can end up in dialysis, which can be temporary, but it can also be permanent. Or surgery. So it's redundant, but I'm just re-emphasizing the importance. So now we're going to have case studies again, so you won't sleep. So 59-year-old female with myalgias, muscle aches, chills, low energy, and back pain. She has a temperature of 101.5. Is that high or low? High. Blood pressure 112/62. That's okay, right? Heart rate is 98. It's okay. Greater than 100. You know, we kind of, for us adults, it should be between 60 to 80, up to 100 sometimes. That's still okay. And then respiratory rate is still okay, 99% on room air. So physical examination is normal except for a cellulitis, which is a soft tissue infection on the low back, which she did not notice. So far, this patient has what? Do we have a source of infection? Yes, yes, it's the cellulitis. Do we have some sears? Sears, or yes, temperature. It's only one right now, right? 2 or more, but it needs to be addressed because it could be sepsis. 2 or more symptoms could be sepsis. So this patient happened to have a white count that's elevated. So that's another sears, sign and symptom. So he qualifies to be sepsis. And we took a lactic acid, it was 4, so it's elevated. Greater than 2 is 4. So this patient is septic, needs to be admitted, be given antibiotics. So this is now the spectrum: sepsis, severe sepsis, and shock. She's not shocky yet, but she's getting into the severe sepsis, so she needs to be taken care of. So it's as simple as that. You know, the things that we don't know, oh, I guess it's severe sepsis now. I better call my doctor. And then it's nice to tell them, hey, doctor, I think I have sepsis. Ooh, where did you find that out? Well, I heard it from Dr. Agcaoili. So they'll look into it closely. But it's all worldwide now. Okay, 79-year-old male from skilled nursing facility with altered loss of consciousness for 8 hours was last seen normal last night at dinner. He has history of diabetes, coronary artery disease, COPD, and high blood pressure. Remember, he has high blood pressure. His temperature now is 102. Is that high or low? High. His blood pressure is 90/45. Low, right? He's on blood pressure medication, 90/45. Maybe it's low. Usually for elderly, we'd like a blood pressure at least 140/90, 140/80. 120 is still acceptable as long as they're not dizzy. Heart rate, high, fast, right? Usually less than 100. And respiratory rate, a little bit fast. And then oxygen saturation on room air without oxygen is low. We are breathing right now 21%. Room air is 21% oxygen. And usually if you check your pulse ox, it's more than 90%, 98, 95. And you are breathing 89. So now, physical examination, the patient is confused, has audible wheezing bilateral with visible trouble breathing. Okay, so do we have sears? We have signs and symptoms, right? Do we have an infection? Not yet, right? With just wheezing, it looks like it's pointing us to the lungs. So this particular patient, they did further testing. The white count was 24,000. His lactic acid is 4, glucose is 300, and we had a chest x-ray which shows pneumonia. So is the patient has sepsis? Yes, because pneumonia is a lung infection and you have the sears. This patient has sepsis. This patient needs to be treated more promptly than just a patient with a pneumonia without the sears. You could have a lung infection. Some of the doctors, they can still treat you with antibiotics, go home, come back in 2 to 3 days, because you don't have very high fever, you're not really short of breath. So it's called walking pneumonia, right, sometimes. But this kind of a patient needs to be in the hospital, needs to be treated within a considerable amount of time. Less than 6 hours. That's what the manual is saying. Okay, 2 more cases. Okay, so 38-year-old female with fever, cough, sore throat, again, muscle aches and chills. So fever and chills for 2 days. History of breast cancer, and is on chemotherapy. So that's his risk factor. Remember, we talked about the risk factors too. Temperature, again, is high. Blood pressure is acceptable. Heart rate is fast, 108. Respiration is okay, 18. 100% on room air, so she's okay. Physical examination is normal except for tonsillitis, exudative, meaning to say with pus and big tonsils. So there is a source of infection, the tonsillitis. There is fever, and there is increased heart rate. So those 2 will qualify you for sepsis, probably on the spectrum of just this sepsis and not very severe, but still sepsis. So that kind of patient will need to call the doctor and be treated promptly, or maybe sometimes, be hospitalized. So she ended up, her positive for strep throat. They did a screen test. White count was elevated, 18,000. Lactate was 4. So this patient needed to be hospitalized, given fluids, IV antibiotics, even if it's just a strep throat, but it's a septic strep throat. Okay? So lastly, this gentleman, 53-year-old, with fever and cough, otherwise healthy, but recently exposed to a coworker with flu. He has a fever of 102. Blood pressure was okay, 124/78. Heart rate was 110. So fever and heart rate. And a little bit breathing a little bit faster, 22. And saturation is 97 on room air. So that's still good, although he has sears, right? Physical examination, normal, except crackles in the lung. So it's, again, pointing you to something in the lung. This patient had a chest x-ray and showed pneumonia. So he needs to be treated. So, guys, I'm hoping that you guys all know how to diagnose, or at least know what sepsis is, and can promptly call your doctor or inform your friends and family that they need to talk to their doctors. And if they're very confused, they're sweaty, just like a heart attack and stroke, they need to go to the emergency room, especially after hours and you can't call your doctor. Don't wait 1 hour or 2 hours, please. If that doctor doesn't call back within 30 minutes, please go to the emergency room. Just like any kind of emergency problems, when you're very short of breath, your pulse is coming and you're really altered, just go to the emergency room and they'll know. Okay? Our sepsis mortality at Washington Hospital, I'm proud to say, is less than 20%, or even in the teens, because we have worked so hard to identify and screen these patients and treat them properly and rapidly as could be. So the most important, though, here is the prevention, and that's when Katie Choi is going to come in and give us a lecture on prevention.
Thank you, Dr. Agcaoili. That was a wonderful overview of what sepsis is. And now I'm going to transition and spend a few moments to talk about prevention, what each one of you could do to prevent being one of those case studies. First, the most effective way to prevent infection is common sense. Wash your hands. We all know that germs spread on hands. What's important to know is to use soap and water, but to let the water run for 20 to 30 seconds. And important as well is to use some friction. And if there's no water available, I would like to thank the Community Relations Department for providing each one of you these nice hand sanitizers that you can use. If your hand is not completely soiled, you could use hand sanitizers. Second thing you could do to prevent infection and to also maintain your health is in terms of vaccination. Especially since we're getting into the flu season, it's important to get your annual flu shot to prevent the viral influenza. And for those of you who are over 65 years of age, to at least get the pneumococcal pneumonia, and if you have any risk factors, especially every 5 years thereafter. Another thing you could do to prevent infection is to cover your cough. And of course, staying healthy is taking care of yourself. Make sure you have regular exercise and eating well. I would like to also speak about the Washington Hospital Sepsis Program. I've had the privilege and the honor to work with an interprofessional group of professionals, including physicians, nurses, respiratory therapists, rehab staff, even from the IT department. And for the last 8 years, I've been able to lead our team and program and really looking at sepsis care here at Washington Hospital. In the recent Tri-City Voice publication just a couple of weeks ago, the headline was Why It's Important to Know About Sepsis, which talks about all the key facts that Dr. Agcaoili just had presented a while ago. But the most important thing of why we have these community seminars is truly to build awareness in our community about sepsis through education. One of the things that we do here at Washington Hospital is that every single patient who comes through our emergency department or who are directly admitted into our hospital, we screen every single patient, every time, every shift. And if there's any change or any condition that's new, because of our team is very interdisciplinary, we work closely with the physicians, the nurses, and other staff to make sure that the patients receive the right care at the right time and that it's very timely that we give these interventions. The guidelines that we use is all evidence-based. We are very up to date with the current evidence-based guidelines in the literature. We stay very abreast, and that is one of the key hallmarks of how we are able to save lives through better sepsis care here at Washington Hospital. I also wanted to just share some of the accomplishments that we have made since the sepsis program started about 8 years ago. Our team has been able to present on an international level on 2 different occasions within the past years. We've also presented several times locally here within the Bay Area community. We are also part of a sepsis collaborative that is a national collaborative, and Washington Hospital was one of the few community hospitals selected to be part of this collaborative, which we are able to share what we do here at Washington Hospital. Other hospitals are just starting to get their program started, and I've been contacted by other hospitals and their contacts of how do you do it here at Washington? Do you mind sharing what you guys do in terms of your protocols, your physician order set? How do you develop the team? So we've been very actively involved and in regards to sepsis care. And as Dr. Agcaoili mentioned, I'm very proud we've been able to maintain the mortality rates here at the hospital very below the national benchmarks. And so we will continue to work very hard to maintain those successes that we have.